All right, well, welcome everyone. Thank you for joining this Altman Virtual Health Talk. We appreciate you joining us tonight. I'd like to introduce Latoya Dickens-Jones. She has been a nurse for over 20 years and a nurse practitioner for 14. She loves doing community service and has a dog named Snickers, and was married in May 2019 to her wonderful husband, Jesse Jones. Currently, she's employed as a family nurse practitioner at Life Care Family Health and Dental Center, an adjunct faculty for Altman College, and is a same nurse at Altman Hospital Serenity Program. So welcome. Thank you so much for joining us, Latoya, and I will pass over the baton to you.
Thank you. So my topic tonight is maternal stress and birth outcomes. We'll just go over like the history, what it is, how to make it better, and what Ohio's doing, or Stark County specifically, what they're doing. So next slide. Okay, and this is just a little bit of history. So Ohio has a very long history of high infant mortality rates. The leading cause of infant death in Ohio continues to be prematurity-related conditions. Premature births can be directly linked to maternal stress, and maternal stress has been associated with increased rates of infant mortality, low birth weight, and preterm birth. Next slide, thanks. So this graph is a little bit hard to see, but it's a good graph. So the green little lines are the infant mortality rate for African Americans. The purple area is for white, the white population, then the overall is in gray. And then as you can see, like the African American infant mortality rate was really high. Like at one point it was up to 20, and it's now down closer to 6. And then like the white infant mortality rate has decreased as well as the overall. So I'm very happy to report that the infant mortality rates are down for the second year in a row for Stark County. And Stark County's infant mortality rate dropped to 6.4 deaths per 1,000 live births in 2018. And that's down significantly from 9.5 in 2017 and 9 in 2016. But we still need to address maternal stress to keep those numbers down. Sorry, you can advance the slide, that's good. Oh, no problem. And then, so what is maternal stress? So maternal stress refers to the stress that a mother experiences during her pregnancy, and that stress can be chronic or acute. So chronic stress is linked to ongoing events in a woman's life, such as unemployment, ongoing familial or marital discord. And acute refers to like sudden stressors that change one's environment or circumstances short term. So an example of an acute stressor would be like a traffic jam or a stressful day at work or like a little argument with a spouse or partner, but they usually clear up, they're not long term. Next. Stress and birth outcomes. Women who experience high levels of stress during pregnancy have a 25 to 60% higher risk of preterm delivery. And sometimes I use terms and I probably should explain. So preterm delivery would be delivery before the due date, before the baby is due. And stress before and during pregnancy has been linked to low birth weight babies, independent of preterm delivery. So that means women who have more stress, their babies are smaller overall. Even if they don't deliver them early, they're just smaller. Okay. All right, so increased maternal psychosocial stress is associated with vascular disorders such as hypertension and preeclampsia, which is a major medical reason for preterm delivery. These conditions are common in women who are African American, older, or first-time pregnancies. And preeclampsia is a pregnancy, we hear that term all the time, and I think sometimes people don't know what it is, but preeclampsia is a pregnancy-related complication. It's characterized by high blood pressure, and usually there's damage to internal organs such as your liver or your kidneys. It usually begins like 20 weeks of pregnancy or later, and it occurs in women whose blood pressure has been normal up until then. And if left untreated, preeclampsia can be very serious and even have fatal outcomes for mom and baby. So next. So the question is, what do we do, or how do we decrease the maternal stress? So I'm going to let you know what the literature says, which the literature states that we should take good care of ourselves, eat regular and nutritious meals, get plenty of rest, do moderate exercise, avoid alcohol, don't smoke or do drugs, don't stress about stress, avoid negative responses to stress, schedule time for yourself, and ask for help. So these suggestions are all great if you have the resources, but what the problem is that mothers that are from lower socioeconomic statuses, doesn't matter if they're Black or white, this can be a challenge. So you can't really take a yoga class if you have to ride the bus and you don't live near a gym, or you can't really eat healthy, you know, if you don't live near a grocery store and you have a hard time getting to the grocery store, or not patients, but women that live in like food deserts. And Stark County has quite a few food deserts where the nearest grocery store it's not near at all. So that's the problem. And Stark County is working to alleviate this problem. Oh, and the last thing is ask for help. So next slide. I'd like to talk about what Stark County has done to help address maternal stress. So there is I guess it's like a coalition or a collaboration of community members. It's called Stark County Thrive. And their overall goal is to decrease the infant mortality rate for Stark County. So they collaborate with hospitals, churches, everyone to help to decrease the infant mortality rate. Another thing that's been done is centering pregnancy, which a lot of people haven't heard of, and it's a group-based prenatal care. So they take like 6 to 10 women that are all due around the same time, and you have your prenatal visits together. So everyone comes, there's like a snack, you can ask questions, and then you break off individually and go have your exam with the doctor. But the good thing about this is that you form like a family with these girls. So they kind of become your support system without you even knowing it. So you may have a week where you don't have a ride to centering pregnancy and someone will volunteer to pick you up, or you have childcare issues and they help with that, or just even things outside of the pregnancy centering group, they become like your family. And the pregnancy centering groups have shown like great outcomes, great birth outcomes. So we're still kind of slow using it, but it is available in Stark County. And one of the last things that we've done is implemented the community health workers, and this came out of the Thrive project. So they work to collaborate with patients to help them get access to essential community resources and to resolve challenges that they may face in the community. So it's kind of like a one-on-one assistant. So depending on whatever you need, they're there to help you to get whatever you need or get you to the place that can get you what you need. And we have community health workers at Life Care. They have them at Altman's Clinic, I'm pretty sure. And they're all over in the community, and you're assigned to one when you find out you're pregnant. So this has really, really, really helped with the infant mortality rates and birth outcomes. And that's it. So that was like a quick and dirty overview of maternal stress. We went over the history, why maternal stress is important, what the problems are associated with maternal stress, what we should be doing to alleviate it, and what Stark County is doing to alleviate it. And we can take questions now if you have any.
Yeah, so I think one of the questions would be then, are there, what happens when a person thinks that maybe they are having some of those stressors? Do they talk to their doctor, or how did the process get started for something like that, or asking for help?
Well, it kind of depends. So depending on what the stressors are, you may be able to get to your community health worker faster than your primary care provider or your OBGYN, because you're in closer contact with them, and pretty much reach out weekly or sometimes daily to the mom. So they're probably going to be able to guide you in the right direction. And if it's something beyond what they can do, then they're going to direct you to your OBGYN. But like they can help get diapers, I mean, get you to with transportation. You know, if you're in an unsafe environment, they can get you the resources to get to a safer environment. Groceries, clothes, there's just so many things that they can help with.
All right. Do we have any other questions? All right, well, Latoya, thank you so much for joining us tonight and giving us an overview about maternal stress. We hope you all have a good evening. Thank you.
Okay, thanks.